Hey everyone, Dr. Luke here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to answer a question about am I too heavy or can you be too heavy to have a knee replacement surgery? Now, this is a common question for folks who are contemplating or considering having a knee replacement surgery is there a weight where you end up, you're too heavy and the surgeon is just not going to do the surgery or it's not appropriate to do the surgery. So first let's talk about why we consider your body weight or more appropriately your body mass index as part of considering having or not having a knee replacement. So really the main reason is that there's increased risk of complications. So the big one, there's an increased risk of infection such as a pneumonia or infection to the joint itself. And this, of course, can lead to loosening and failure of the knee replacement. There's risks of blood clots or deep vein thrombosis. There's risks of chronic or persistent pain after surgery, and just general risk of failure of the knee replacement. Now, of course, we don't look at body weight by itself. We actually want to look, again, at body mass index. So that's your weight divided by your height squared. So that's going to be in kilograms over meters. Of course, if you want to know what your BMI is, there's a lot of useful tools on the internet. If you just do a quick Google search, you can probably find one where you can input your weight and your height and find out where your BMI is. Now, different surgeons, depending on who you would talk to, will give you different values of kind of what their cutoff is of doing knee replacement surgery. A lot of times you'll hear 40, a BMI of 40 or higher is kind of that cutoff. Some surgeons will bump it up a little more than that. Some will be a little lower, maybe closer to 35. A lot of it comes down to the specifics of you as an individual. So for example, if you're someone who has other comorbidities, maybe you have diabetes, maybe you have a history of cardiac issues, history of issues with your vasculature, your arteries or veins, you may be a little higher risk, and the surgeon may be a little more cautious about providing or giving you a knee replacement surgery if on top of those things you also have a very high body mass index. So there's really no specific cutoff, there's no specific guide in the literature, but usually that's what you'll see is somewhere around a BMI of 35 on the more conservative end to about 40 on average, to some surgeons will bump that up even a little more. Now, if you're someone who is really struggling and really disabled and having significant issues and impairments from knee pain and knee arthritis issues, a lot of times you'll see surgeons who will, they'll still do a knee replacement surgery in certain circumstances. So it's always important to have that discussion and consider all the pros and cons with your surgeon and his or her team. So what do we need to consider? Well, we need to consider, if you are someone who needs to lose weight or it's recommended that you lose weight before having a knee replacement, you just need to be able to set a realistic goal for you and what you may be able to achieve prior to your surgery. Now, the benefits of losing weight, any weight that you can lose, is of course one, the stresses and the forces that are going through your knee and your new knee replacement, helping to kind of decrease those stresses and decrease those forces. You're decreasing your risk of complications. Any amount of weight that you're able to lose and get down into a healthy body weight is going to help decrease your risk of having complications from knee replacement surgery. And also you're just going to be healthier in general. You're going to feel better, your body's going to be functioning better, you're probably going to have better mobility, better ability to rehab and recover more efficiently after the surgery. Now, of course, the common question is, well, if I have all this knee pain, then how am I supposed to exercise? How am I supposed to lose weight? And I always tell people that's a tough one. Important things to keep in mind is a little bit is better than nothing. So even if you're just doing some things sitting in a chair, laying on your bed and doing a couple exercises every day, that's better than nothing. Some of the best tools I've always seen are aquatic exercise or pool exercise can be tremendously beneficial, really can offload the forces and the body weight through that knee joint and help you tolerate different exercises and movements better. Trying different machines, maybe doing a cycling, a recumbent bike, something like that, may be what gives you that ability to at least do some exercise. So some is better than nothing. And on top of that, there's other aspects of your health that can help you to lose weight. So of course the big one being diet, looking at your diet, reviewing your diet, what are some small changes here and there that you can make? Maybe it's eating less sweets, maybe it's limiting the salt in your diet, maybe it's limiting, drinking soda or unhealthy sports drinks or something like that. So the key is, maintain a realistic perspective. Any little bit that you can do, any little bit of weight that you can lose will be helpful and beneficial in the long run. But really it's going to come down to that individualization, to having that discussion with your surgeon, where are you now? Where would they like you to be? And, what are the pros and cons of going through with a knee replacement surgery? I hope you found this video helpful. Please be sure to hit that subscribe button so you can follow our channel and watch all of our videos related to knee replacement surgery. Please be sure to hit that like button if you found this helpful so it can be spread to other viewers. And of course, leave your comments and your questions below as we do our best to get back to everyone we see. Thank you very much for watching.